For more now, I'm joined by Dr. Gregory Jantz, the founder of the Center of a Place of Hope in Edmonds, Washington. His most recent book is called So Much to Live For: How to Provide Help and Hope to Someone Considering Suicide. And, Dr. Jantz, I got to say, I was struck by a recent quote in the New York Times saying that people spend more time picking a restaurant to go eat dinner at that night than they do spending, picking a rehab. All rehabs are not created equal. People need to do some due diligence. How do you pick the right one?
Well, and hearing Tina, this is tragic. Let me just say there are some excellent rehabs who do a great job, but there's also so many that do not. And one of the things that if I call up and the first thing they ask me is, what's my insurance? That's a warning to me. Or the first conversations around money, that's a warning. They say, well, we'll fly you there. That's a warning. So is it a place that has sincere care, where there's real teamwork, where we can address underlying mental health issues when they need to be addressed? Do they really have that kind of whole person care? I've been doing this for 38 years, and I can tell you the importance of bringing together the mental health and the substance use. You've got to address that.
Yeah, they're
anxiety,
intertwined.
depression.
They're intertwined. People, they start to drink or do drugs because they're trying to self-medicate. Anxiety, depression, bipolar, something. Nobody just wakes up and says, I'm going to abuse myself for no reason. These rehabs, though, can cost a fortune. And for some families, it's one shot. They, scrimp together all their savings, and they only get one chance. And the tragedy is that families like the Caracellos pick one where their loved one is not being well cared for. Are these rehabs regulated?
Well, there is regulation. It depends on which state you're in. Some states are known for having kind of a lot of kind of free-for-all, and there's some things that are not so good, things that really concern me. I'm in this to save lives, and we've got to look at these are people's lives. And you have addiction, you have mental health issues, and today we really have to address both of those in a unique way. Now, one of the things that's happening is there are kind of third parties that are trying to hustle patients in, and they route them to different places. So there are unethical things going on. I know that happens.
Yeah, there's something called the Florida Shuffle. It's a revolving door between sober living houses and rehabs. And, they leave the rehab, they go to the sober living, they relapse, they go back to the rehab, mostly because the care isn't sufficient. It's a big business.
Yes, and we've got oh, absolutely. And we've had a lot of folks who have really, I'm going to say, victimized by that system and taken advantage of. You're already at an incredibly vulnerable place. When a person says, yes, I will get help, we need to make sure they get the right kind of help. I always suggest call 3 different places, gather information, trust your discernment, talk to patients. There are those that will tell you what their experience is, but don't go with the first one. Dig in deep and get information. It's so important. This is a life we're talking about.
Yeah. It is, and in this case, one was lost. Dr. Gregory Jantz, thank you so much for some important information for the 20 million Americans suffering. Thanks.